Well, the percentage of kindergartners in Colorado who have completed their childhood vaccines before starting school, it's actually shrinking. Public health officials concerned the trend could lead to serious disease outbreaks. News 5's Andy Cohen in studio tonight with a closer look at the data, sharing new research, Andy, about strategies could help reverse this trend.
Absolutely, Rob. Many of the illnesses that are a part of these childhood vaccines protect against highly contagious illnesses, so they require very high levels of vaccination to create herd immunity. So, for example, if you take a look at just the MMR, measles, mumps, and rubella vaccine, at that rate below 87%, where the ideal target is above 95%.
The number of kindergartners entering school this month who've completed their vaccinations fell to its lowest point in the past 6 years. The measles, mumps, and rubella shot has an even lower compliance rate.
About 86.8% of kindergartners were vaccinated this latest year, and that's down about 2%. So we are seeing specifically that one having more decrease.
All three diseases are highly contagious.
Measles are so incredibly infectious. They're respiratory. You walk into a room and you can infect 15, 20, 30 people in a few coughs. The vaccination rates have to be really high. Generally, for some of these, we're looking at 95%, which classically we've been able to do in America.
Most children who get sick with measles develop a rash, cold symptoms, watery swollen eyes, and a high fever. But severe cases can be deadly.
It can cause encephalitis, meningitis. There's some really, really negative things that can happen, as a result of measles, and especially in immune compromised children or even adults, that's a significant concern.
Officials with Immunize Colorado believe too many parents are getting bad information about vaccines from social media. They also suspect the pandemic harmed public trust in health institutions.
Do you feel like there's more mistrust these days of public health officials?
I do. I think that that the pandemic did impact the visibility of them in the community, and also then drew more attention and concern. But I think that they're really out there, and people need to understand that they're there to help and to bring, well-needed resources, health resources into the community.
However, new research suggests that vaccine hesitancy may not be the only reason kids are falling behind.
And those, to us, seem more like structural barriers than vaccine hesitancy.
Dr. Matthew Daly is a pediatrician and researcher who reviewed answers from some 16,000 Americans in a 2019 vaccine survey.
And what we found were kids who had lost their health insurance were more likely to be under-vaccinated. Kids who had moved across state lines were more likely to be under-vaccinated. Kids from households that had a lower income were more likely to be under-vaccinated.
He believes healthcare professionals can help by mailing, calling, or texting parents a vaccine reminder.
But also as physicians, we need that reminder too. That's something called a physician prompt, which is where if I'm seeing a child for an ear infection or for something else, if I work in a setting that has an electronic health record, if that health record prompts me and says, oh, this child's missing their last dose of a vaccine, then I can say, oh, I can go ahead and do that today.
And for parents who have concerns about vaccine safety or the ingredients used, these professionals recommend sharing your concerns with your child's doctor.
And Dr. Daly told us he plans to review similar survey results that were conducted during the pandemic years. And he's going to take a look at that for future research. Andy Cohen, News 5.
Andy, thanks.